The blood contains proteins. The most abundant is albumin. You can imagine that these train cars are albumin molecules that move through the bloodstream. So they're attached to a larger system that's transported throughout the body. Albumin acts as a transport system and as a reservoir for molecules that the body produces. This would be things like bilirubin, free fatty acids, and other endogenous molecules. Albumin carries these through the body to where they're needed and also prevents them from being eliminated too quickly. I'm Dr. Susanna Vanderpool. I'm a neonatal and pediatric clinical pharmacist. In this video, we're going to build on these concepts more and more so that by the end, you'll understand the more complicated aspects of protein binding as they relate to medications and my favorite population to discuss, neonates. So now let's talk about what happens when we introduce a drug to the system. Highly protein-bound drugs like ceftriaxone and phenytoin rely on albumin for transport, but not all drugs need to ride the train. Hydrophilic drugs can circulate more freely in the bloodstream. These highly protein-bound drugs that rely on albumin use it to be transported to their intended destination, which might be a specific receptor site or tissue in the body. When they're bound to albumin, they're inactive. It's not until they get to their destination that they become unbound or free drug. And this is a proportion of drug that has its pharmacological effect. Also remember that albumin molecules have a finite number of binding sites. And so once these binding sites are saturated by endogenous molecules or other highly protein-bound drugs, there will be an increased free fraction of these highly protein-bound drugs. And this can theoretically cause toxicity. But it's really only clinically relevant for drugs that are both highly protein-bound and have a narrow therapeutic index, so drugs like phenytoin and valproate. So now let's apply this concept to a population that I work with every day, neonates. And let's see what happens when we remove some proteins from the blood or take some of the train cars off of the train. Neonates have decreased levels of albumin in their bloodstream and decreased binding affinity. And so they'll have a higher proportion of unbound drug compared to older children and adults when we're talking about highly protein-bound drugs. Because they have less albumin, there's also more competition for binding sites on albumin. So for example, ceftriaxone can displace bilirubin from its binding site on the albumin molecule. You can think about ceftriaxone as a premium first-class passenger that can kick off bilirubin, a coach passenger, from its seat on the train. Remember that neonates also have high levels of free bilirubin in their bloodstream at baseline compared to other populations. And so, theoretically, if enough bilirubin is displaced by drugs like ceftriaxone, the levels of bilirubin in the brain can be high enough to theoretically cause bilirubin encephalopathy. I cover this in my video on ceftriaxone's relative contraindication in neonates if you want to check that out. Something else to think about that's really specific to neonates is drug level monitoring. When we measure a serum drug level, we're measuring both the bound drug and the unbound drug. But remember that the bound portion is the pharmacologically active portion and the portion that causes toxicity. So in neonates that have higher proportions of free drug for these highly protein-bound drugs, their level may appear therapeutic, but really they're experiencing toxicity from the drug. And so we may have to lower our therapeutic range to account for that increased free drug and increased risk of toxicity. There are some drugs that we measure free drug, like phenytoin monitoring, for example. We can utilize the free drug level, but actually that is usually not a true free drug level. It's usually an equation that's applied to a drug level that assumes normal albumin levels and typical protein binding behavior. And so that free drug level isn't actually a reliable measure of that free drug. Thank you so much for watching. If you liked this video, please subscribe and let me know in the comments what topic you'd like me to cover next.